Good afternoon. I'm Lisa Clute, the Executive Officer at First District Health Unit. I'd like to welcome you to our press conference. Joining me today at the press conference is Roxanne Benzel, the Director of Nursing at First District Health Unit. Dr. Wigway, he is an infectious disease doc and the health officer of First District Health Unit. Dr. Dawn Mattern is a board member of First District, as well as our deputy health officer, and Dr. Sather, chief of staff at Trinity Hospital. The reason we're here today is we have received a lot of questions regarding vaccine, who's eligible for vaccine. They have various questions about the vaccine, safety of the vaccine, the various types of vaccine, and so we wanted to answer those questions and provide you that information. First of all, to let you know where we're at, we have seen increased vaccine coming into the communities that we serve. Again, First District serves Bottineau, Burke, McHenry, McLean, Renville, Sheridan, and Ward counties. So at this point, as of yesterday, we have given 2,678 doses in Bottineau County. 29.9% of their population have received one dose, at least one dose. Burke County, we have given 604 vaccinations. 20.8% of that population is vaccinated. McHenry County has 1,750 doses or have been given, and 24.9% of that population. All these percentages that I'm giving you is for at least one dose. Renville County has 648 doses given, with 21% of their population receiving at least one dose. Sheridan County has 501 doses have been provided. 28% of their population has been vaccinated. Ward County has been given 17,472 doses. 20.2% of that population has received one vaccination. I have to take this opportunity at this time to thank all the healthcare providers that are working so hard at doing this. This truly has been a community team effort to get these vaccinations out. So there are several access points for vaccine. You can contact First District Health Unit at 852-1376. Thrifty White has vaccine available. Go on to their webpage and they will let you know when and who and so forth can have vaccine there. Private providers, Trinity at this time is still sending out invitations, so it is an invitation only. However, most of the other smaller providers throughout the district, you should call them and make the arrangements. All of these vaccines are provided with no out-of-pocket costs to anybody. In regards to who is eligible to receive the vaccine, at this point, if you receive a paycheck and are breathing, you are eligible to have vaccine. Any size paycheck, if you are in college and have a side job, that qualifies. Roxanne will talk about the age groups, but in general, it's 18 and older, with an exception that she will talk about. So where we're at right now is we will be monitoring the demand of the appointments, and we will likely move into the next group next week. But stay tuned for that announcement. Now, not all providers may move into that group at the same time, and have the vaccine available, but that is our hope, that we would get there by next week. I'm not making that formal announcement, I'm just saying that is our goal. So stay tuned for that announcement. We have seen some uptick in some cases, particularly clusters in schools and some businesses in the community. So I just have to reiterate the importance of following these mitigation strategies. As you hear, the vaccination rates are not high enough yet, and with the variants being in the community, we need to assure that people are following these mitigation strategies. It is our primary goal to keep these kids in schools, to keep them in the activities that they enjoy and love, and provide the activities that we all want to attend. So please, please continue to practice these mitigation strategies so we can keep everything going that is going. That is our primary goal always. So with that, the information regarding the cases is within First District. Within the last 14 days, we have had 161 additional cases. If you go to our Facebook page, you can see where each of those are at per county. And positivity rate for the district is 3.4%. The positivity rate, again, that is the tests that have come back positive based on the number of tests that are conducted. In Bottineau County is 4.1%. Burke County is 5.2%. McHenry County, 7.1%. McLean, 2.6%. Renville, 1.2%. Sheridan, 0. Yay, Sheridan. And Ward County, 3.2%. So again, we want to make sure that we are, I mean, the end is in sight. It is so close we can touch it. So just continue to practice these mitigation strategies. You all know them by heart. You've heard them over and over and over again. That is not saying don't attend events and activities. It's saying just to do it safely. So help out our communities in keeping these schools going strong. Testing continues to be available. It's available at First District Health Unit. Again, call our office for an appointment. MSU is, we still have testing going on there. And Coda College in Bottineau. Rapid tests are available still at Minot Fire Station. So check out each of those organizations' website, Facebook page, and you can see when testing is available for you to access. So for the most part, you should be able to get into a test of one of the, either the PCR or rapid tests every day of the week within the Minot community. If you need tests done and you live in a more rural area, you can contact your county public health unit, and they will make those arrangements for those tests. So with that, I am happy to introduce Roxanne Benzel. She has been our Director of Nursing, or is our Director of Nursing, and has done an incredible job with all of this. So she is going to provide you some more detailed information on how and where to get the vaccinations.
Hi, like Lisa said, my name's Roxanne Benzel. I'm Director of Nursing at First District, and I'm just going to go over who can get vaccinated? And Lisa had mentioned it very well earlier. We are vaccinating anybody that's in groups 1C, 1B, and 1A. So essentially, if that is anybody that is working, anybody that is considered an essential worker is eligible. Ages 18 and above can go onto our website at First District and can register online. Pfizer vaccine is available for the 16 and 17-year-olds. We do prefer that you call if you have a 16 or 17-year-old that is wanting to be vaccinated. And the reason for that is that it's only the Pfizer vaccine that is authorized for that age group. And so we never know on the day what vaccine we're going to be giving. Sometimes it's a mixture of maybe Pfizer and Moderna. At this point, we have not yet received the Johnson & Johnson vaccine. So if you give us a call, we're able to give you a call back and let you know what day we might have that available. The 16 and 17-year-olds also need to be accompanied by a parent so they can sign the consent for them. When you get your first dose at First District, we will automatically sign you up and register you for your second dose, so you don't need to worry about that. And it's also important to remember wherever you get your first dose that you do try to go back and get your second dose at that same facility. CDC released some new guidelines this week about what fully vaccinated people can do. And it's actually very exciting because now if you've been fully vaccinated, which means it's 2 weeks after you have received either your second vaccine if it's Pfizer or Moderna, or Johnson & Johnson is just one, so it's 2 weeks after either of those, you can gather indoors with other fully vaccinated people without being masked or having to social distance. You can also gather indoors with unvaccinated people from a single household, as long as they don't have any severe underlying health conditions, which means the grandkids can go see grandma and grandpa if they're vaccinated. So it's opened up a whole new world for these folks, and it's amazing. So we need to make sure everybody is getting out there and getting vaccinated. The other thing that it also does is it takes you out of quarantine. If you're fully vaccinated, you do not need to quarantine for the 14 days if you've been exposed, unless you become symptomatic. So as long as you are asymptomatic, you do not need to quarantine. All right, and with that, I will turn it over to Dr. Wigway.
Good afternoon. I'm Dr. Wigwe. I'm the health officer for First District Health Unit and the infectious disease director at Trinity Hospital here in Minot, North Dakota. Thank you, Lisa, for this opportunity to talk about the vaccines that we have available for the control of coronavirus or COVID-19. There's two kinds of vaccines that have been licensed so far for prevention of COVID-19. Two of them are what we call the mRNA vaccine, and one of them, the Janssen vaccine, is the adenovirus or viral vector vaccine. Both are fairly recent technologies in that they've been licensed for use only recently. But they've been in development for many years. After my fellowship, I actually worked on trying to develop a vaccine for HIV, and we were, actually talking about some of these technologies. They were tried before, they didn't work out well, and over time, people have found out what made them not work before. So this has been in development for many years, but this is the first time it is ready for prime time. And so that made it easier to ramp it up once the outbreak of COVID-19 became a pandemic. So the of the Operation Warp Speed, what it did was it looked at the candidates that were sort of likely to succeed and started making the vaccine even before it was approved. So it wasn't after the approval that the vaccines were made. The vaccines were already, being made even while the studies were ongoing. The advantage of that is that, once it's approved, it will be ready, because if we waited until it's approved, then it will be approved and then we'll go through the manufacturing. As you know, making these vaccines takes a lot of time and involves so many processes. So while the whole process was accelerated, it wasn't, the time was compressed, but the quality was not compromised. Again, in fact, something that people don't realize is that the viral vector vaccine for Ebola was actually approved in 2020. So that technology have been used in making another vaccine that I was actually licensed, and because of the success of this technology, is now being developed for other diseases, even as we speak, including HIV, tuberculosis, and malaria. So there are two things that fueled the speed of development of this vaccine. One was the enormous investment from the government. So it wasn't like before, when the private sector will have to go through the process and figure out whether it is worth putting in more money and go through the trial and everything. So the government, various governments, not just the U.S. government, invested heavily into this process because of the public health emergency that this was. And the other thing was there was a lot of, because the disease was spreading rapidly, so it's easy to recruit 30,000 volunteers within a very short period. If it was any other disease that wasn't, you didn't have to, it would take you years to get, to recruit 30,000 patients or volunteers and, get enough information as to decide whether it is actually effective or not. Imagine it this way: if it's let's say, say Lyme disease, for instance, where there's only maybe 20 or 100 cases that cases that would happen in North Dakota in a year or in a season. It will take you several seasons or several years to give the vaccine to a certain number of people, so that if it's actually effective, you will see it, so that people who got the vaccine will be protected compared to people who didn't get the vaccine. But if the disease is spreading rapidly, spreading like wildfire, it's easy to actually get the result quicker and faster. So that's one of the reasons why it was easy to get an answer sooner compared to what we've seen in the development of other vaccines. So the vaccines have been studied, and in Israel, which has beaten every other country in terms of the rate of vaccination, they've shown us the real world statistics of what happens when a large number of a population have been vaccinated, and they've seen protections. Actually they've shown that the level of protection is comparable to what was seen in the studies, which is about 94-95%. When they looked at the real world effectiveness of the vaccine. So the other issue that I think is important is we should get vaccinated. Even if you think you've been infected before, or even if you know that you have been infected before. We do not know how much protection that the natural antibodies or the natural immunity that you get from the infection confers on you. One of the things we're seeing, again, the good and the bad thing about this disease is, because it's spreading so fast, you don't really need to, whereas the studies are happening right before our eyes. We're seeing what happens, for instance, when people wear masks or when people don't wear masks. It's happening. You don't have to conduct any control studies, because it's happening as just as we speak, literally. In Brazil, where the virus is running rampant, they've developed variants. Even people who have been infected before, areas that have been previously devastated by the virus, they are now having a second wave. You think that if you allow the virus to spread, and that you will achieve herd immunity by that, and you wouldn't need the vaccine. We're now seeing that even after the first wave, that the virus can mutate and come back again and reinfect it. Whoever is left. So variants develop when the virus is allowed to spread unchecked in the community. What variants? It's just natural evolution of the virus. It can replicate, it can make large copies of itself in a matter of minutes to hours. And as this happens, there are some changes. It's not an exact replication. There are, minute changes. Amino acids change. Here and there on the structure of the virus, particularly on the proteins that cover the virus, which is how it gets attached to the cells when it gets infected. As these changes happen, some of them are inconsequential, but some of them actually confers it either a survival advantage in which the antibodies that you have from other previous viral infection doesn't protect you. Some of them confers it the advantage that it can infect other people easily, and it can be more lethal in that it can kill more people than the original infection. So this is what happens, when as the virus replicates and goes from one person to another, variants develop. That is the natural order of things when it comes to viral infection. And I'm sure there's more variants than the ones that we already know exist if you look for them. So that is why it is important that we all get vaccinated and we all continue to practice wearing our face covering and social distancing until we can bring this infection under control. And once we do that, and the virus is not spreading, then we don't have to worry about the variants. We do not know exactly how much protection that the vaccines confer against all the variants. The UK variant doesn't appear to be a big deal. The South African variant maybe. The Brazil variant is still debatable. But again, the most important thing is that if we can stop infection, stop the spread of the virus, it's not likely to develop variants in the community, and that's the best way to prevent infection and prevent more death. Nothing else. There's nothing else that we know so far that we can do to prevent more people from getting infected or more people from dying, unless we incorporate these three things: face covering or face mask, social distancing, and getting vaccinated. Those are the things that we have to do. Antibody testing and vaccination. I don't recommend it. As you know, the CDC recommends that everybody be vaccinated that has not been vaccinated. It doesn't matter whether you've had infection before. If you've been infected before, you could, based on the availability of the vaccine, you could wait up to 90 days before getting the vaccination. That is not what is recommended. The only reason why that comes into play is if vaccine is not available and there's someone that has been infected before and there's someone that has not been infected, you could let the person who has not been infected before, go ahead of the line. But if there's vaccine available, everyone should get vaccinated irrespective of whether they've been infected before or not, so that we can get that extra protection and prevent the spread of the virus in the community, and so that we can, control this virus sooner. Any other thing that we try to do, believe me, it is my goal to get back to normal. We want to get back to what we used to. But trying to circumvent the process is only going to delay things, because if we, God forbid, if we have another surge, then we'll go back to trying to tighten up things. But if we move slowly, eventually we'll all get there sooner than than if we try to circumvent the process. Thank you.
Thank you. My name is Dawn Matter, and I'm the sports doc in town, so my brain wraps around sports. So a couple things that I want to say today is you miss 100% of the shots you don't take. And that means a lot right now. So my goal is to get as many taking their shots as they possibly can right now. I highly recommend it to young folks who think that, hey, I might not be in that risk category. But the other thing I want to point out is that you're doing it for your team or our community here. When I was here in August when this was starting, I talked about how playing sports and being in activities was a team thing more now than ever. It was our community that needed to come together to make the sacrifices, to practice the mitigation strategies, and allow our kids, our athletes, our folks to be able to do their exercise, their activity, their sport. Last weekend, we just wrapped up the State B girls tournament here, and we were successful through that season. We're closing up with State A basketball this weekend, closing up with State B boys after that. So we are making our way with mitigation strategies through an unprecedented year. And I am very proud that we have been able to do that. That does not mean that the game is over. That means that we need to keep the pressure on. And I need to help encourage as many folks, as many as my athletes, as many as my parents of athletes, to consider getting that vaccine, whichever one you can get signed up for first. But I think that will allow us to safer continue to play sports, continue to travel, continue to exercise, and continue to be healthy. Next week is spring break for Minot State, and typically it tends to be a joyous occasion of travel. And a lot of folks that I've talked to, it's going to be a little bit less travel this year, and they're going to do a little bit things closer to home. And my ultimate goal is that, hey, if we make these sacrifices now and you come back after spring break, or if you stayed home, we can get these college kids as well vaccinated. They're going to be going home to their parents safer, which means a safer community, and that we're all going to be able to get through this. So take the shot, and your team needs you. So make sure that you get out there, find where you can get your vaccine, and get this vaccination project going. Thanks.
Hello, Dr. Jeffrey Sather. I'm Chief of Staff at Trinity, and I want to really cover three basic topics, and that's to touch on some numbers of patients at the hospital and where we're at with strategy around caring for patients, and then talk a little bit again about vaccines and our vaccine strategy at the hospital, and then touch on treatment if you get coronavirus. First, some basic numbers. It's been a heck of a war this past year is how I look at it. And I remember not many months ago, it felt like we were losing that battle. And the time when our hospital had an entire floor dedicated to COVID patients, a good portion of another floor dedicated to COVID patients, and an ICU that was essentially full of COVID patients with a significant percentage on ventilators. We're at the point that we are cautious, observing, but optimistic at this point, because we have tools come into place that is starting to allow us to win the war. And so in our hospital now, we have contracted back our COVID unit to one wing, which is what we started out with a year ago when we first developed COVID area to take care of patients before we had patients. And today we're down, I believe, to 8 patients in our hospital, only 2 of those in ICU, 1 of those on a ventilator. And over the last just few weeks, we've been running in that 6 to 8 patient range. So again, we're cautious but optimistic and just watching that very closely. We continue to test symptomatic patients not only in the hospital when they come, if they come for treatment for something, but also at our drive-up facility. And if you want to be tested if you're symptomatic, you can call 857-7817 to get a time to come and be tested through the drive-up. We are still seeing almost daily some positive patients show up. So this isn't totally gone from our community, and as Lisa talked about in some clusters, it's still out there. And so if you're symptomatic, you should be tested. If you're positive, if you have comorbid conditions, you should also be treated. And we have a treatment available with monoclonal antibodies, and Dr. Wigway's clinic oversees that area. And patients who are positive, even if you're relatively asymptomatic, if you have comorbid conditions and are of a certain age, you should get treatment. That treatment is an outpatient infusion, and that can be scheduled by calling your primary care physician and talking to them if you're a Trinity Health patient. If you're not a Trinity Health patient or don't have a primary doctor, you can call our Doctor For You number. It's 857 Doctor For You. That number is 857-3748. And as soon as you find out you're positive, especially if you have comorbid conditions, you should call to get screened for treatment. We've seen a great reduction of hospitalizations, comorbid long-term problems from coronavirus, and decreased deaths across the nation because of that treatment. So that's really important. Lastly, I want to just touch on where Trinity's strategy around vaccination has been and what we've done so far. And we're hoping in the not very distant future, as vaccine supply becomes more and more available, to switch over to a more normal methodology of getting vaccinated, where you can just come into your doctor's clinic. What we've done in the short term, first I got to say, North Dakota as a whole, I don't know how much the public knows how our vaccination program in the state has been so successful across our entire state. And we've been commended in multiple formats for the amount of people we're able to get vaccinated and how we're able to get through that within the state. We took on the strategy at Trinity, which I've heard colleagues from across the country in conversations really be amazed with, and I think is important, because we took on the strategy that we wanted to vaccinate the most vulnerable first. And it actually became very easy for us to do that in the world of electronic record, because we have this huge database about our patients. We knew our patients' ages, we knew what other comorbid conditions they had, so we were able to literally risk stratify patients from the highest risk on down. We, to date, are approaching, this weekend we'll pass 10,000 doses administered of our patients. And the methodology we're using is we're sending out invites to our patients when their number comes up, and they have the option to accept or decline. They're getting email, texts, and calls on that. If you do get a call and you want to be vaccinated, answer that as soon as possible, because we get shipments. We were getting shipments every 3 weeks. Those shipments are coming now more frequently. We had a clinic last week, another one this week. And we, to date, have had a name for every single dose of vaccine that we've received prior to the day, and they've come through and have been able to get their vaccines. So we'll top 10,000 doses this coming weekend. And we're at level 1C, like I think most people are, which is essential workers, and sorted out by vulnerability. And hopefully very soon we'll be opening it up to anybody that qualifies as we've gone through the list by invitations. Vaccination hesitancy is something that we see. People are hesitant to get vaccinated. And the reason they are, people are inherently afraid of the unknown. And everything's a risk-benefit ratio. Getting in my car and driving here was a risk. I could have gotten in a car accident. And so everything in your life's a risk-benefit. Everything in medicine, we as physicians, that's how we think. When a patient walks in that has a disease that needs surgery, there's a risk of getting the surgery. There's also a benefit of getting that treatment. And so if you have a cancer in your colon, for example, that is not spread, getting that colon out will save your life long term. Going to surgery has a risk with it. Every vaccine, every medicine you take has a similar risk profile. Going to the cabinet and getting an aspirin has a risk, but most of us will go get our aspirin or our Tylenol. So getting a vaccine, the risk is tiny when you look at statistics in general. We see patients almost daily in our clinics that are months out from having coronavirus, that have long-standing issues around that disease. We have seen patients in their 20s with cardiomyopathies, which will affect them the rest of their life. The risk of the disease is so great compared to the risk of not getting the disease. Even asymptomatic patients have been shown to have some of those lifelong, life-changing issues. So getting that vaccine is important. We encourage everybody. And there's the notion also out there is, well, I had the disease, or I had an antibody test, and I found out I had antibodies, so I don't need the vaccine. That's false. It's recommended by the CDC, even if you had the disease, that you get vaccinated. We have had multiple instances within the state of North Dakota where people have now had coronavirus twice. So getting that vaccine is important, and the antibody test really is meaningless in my view, because you should still get vaccinated. If you were asymptomatic, didn't feel you had the disease, and you got tested for antibodies, it doesn't matter. You need to get vaccinated. So that's everybody's choice, but we want people to be informed. If you have hesitancies, I would encourage you to call the health professional that you see on a regular basis that knows you and that you trust, and talk through that with them. There's always somebody that for some reason maybe shouldn't get something. So if you think, well, I've had allergies to this or that, maybe I shouldn't, talk it through with your health professional. In the end of the day, I'm looking forward to the day that I don't have to wear this mask anymore. So that's where we want to get. And the last thing I want to mention is where we're at with visitor restrictions at the hospital. We are at what we call our minimum level of visitor restrictions. That means patients can have visitors at the bedside up to 2 at a time. You can't have 8 or 10 people come in the room. Our visitors are still screened at the door. For symptoms, you have to be asymptomatic, and masks are mandatory with this respiratory virus pandemic going on at the hospital. Thank you.
Thank you. So I did want to reiterate the good news is we have a very high percentage of our high-risk population, long-term care residents, vaccinated. That is such good news. If we see surges and so forth, we have done a good job in getting those people vaccinated. I also want to continue to reiterate, you know, when we talk about health, it isn't just whether or not you're sick or not. We get that health encompasses healthy communities, being active, taking care of yourself, and so forth. Continue to do that. Exercise, eat well, and just take care of yourself. You know, those the multivitamins, there's various recommendations for, you know, zinc or whatever that may be. Just make sure that you are using recommended dosages on that. So with that, I would be happy to answer any question. Well, it won't be me answering questions. I have a whole host of experts here that will answer your questions. So, Jill.
You mentioned you're getting to the point where anybody who makes a paycheck is eligible. But that's a lot of people, so I'm wondering, are you on a waiting list? Do you have to call back? How do you handle volume?
Jill is asking about anybody that gets paycheck, and if we are creating waiting lists and so forth. At this point, when we go into that, and we are into that group, anybody that receives a paycheck now is considered essential worker and can receive vaccine. At this point, we've been able to handle all the all of the people wanting to make appointments. So the challenge always has been and continues to be how much vaccine we will have every week and so forth. So we are matching the demand for the vaccine with the availability. But with increased vaccine coming through, we've been able to accommodate everybody. I do also want to say that if you are homebound and cannot access vaccine, you can call First District Health Unit. That we do have a list for, and when we have enough people on that list, we will send out a team to serve the homebound.
So the question was, how about hospital morale and where are we at? And I think it's a correct statement. We had a lot going on that was very rough on certain segments of our staff taking care of patients and very sick patients, and seeing a large percentage of death in a similar way on an ongoing basis. And I think overall, and I'm giving you my overall sense as being part of the team there, is I think our morale is pretty good. I think because we're not seeing the same thing, of course, the staff isn't going through those things long term. We're worried about our staff. Leadership of the hospital is worried about our staff long term. If you think of anyone that's been in the military and gone to a war, the war's over, but the memories aren't. So we have programs in place for that for our staff, and so we are there as an institution to support our staff in those things. And so when I say I think our morale is pretty good, we have an incredible workforce. And Trinity is one of the very largest employers in this entire region. We have, short of government, here in Minot, we are the largest employer. And so we're a big part of the community, and when you look at your neighbors, you don't have to look very far in your family or friends to find an employee at Trinity. And I hope they feel supported in everything they're doing, and I think morale has improved over that as well.
My question is also kind of good to you as well. Do you know anything about Trinity Homes? Can you give us an update on Trinity Homes still? Are they still in lockdown?
So the question is Trinity Home still in lockdown? I don't have the quick answer to that off the top of my head. They've, so Trinity Nursing Home rules are different than hospital rules across the state, and the recommendations from the state. And I don't have that right off the top of my head to give you an answer. So we can get that to everybody though.
Okay, if there are no further questions, I want to thank you for tuning in, and stay tuned. We will continue to provide information as it's requested and needed, and stay safe and stay well. So enjoy this wonderful spring weather.